So why is it that Pregabalin or Lyrica is such an effective medication treatment for things such as nerve pain, for even things such as migraines, fibromyalgia, and just general pain in general? One main reason this might be, it's because Lyrica or Pregabalin, I'm just going to call it Lyrica from now on, it's not that it attaches to dopamine receptors like some other opioid medications or opiate medications. But what it does do is it helps regulate the amount of dopamine that could be released. It doesn't attach, it regulates. So it can regulate things like dopamine, serotonin, and in particular GABA. That's what it's known for. There's another medication, for example, called gabapentin that's very close, and it's not the exact same thing, but it's like the brother and sister of medication. Gabapentin and Lyrica are very close in molecular structure as well. The difference is that Lyrica is a little bit stronger, it seems. And one thing I've noticed in particular recently is there have been patients who've reported this in the past, but not just patients. There has also been more studies coming out that has been showing how effective Lyrica can potentially be for people going through opiate withdrawal, or even more particular, fentanyl withdrawal, or the worst being that, the carfent, the stuff that's it's like a tranquilizer essentially. It's like 1,000x stronger than fentanyl. There are studies showing that for the physical withdrawal, in particular fentanyl or that carfent stuff, that the only treatment that is known to really help you get through that first 5 days of that physical withdrawal is Lyrica. There have been studies that have shown for people who, right when they stop the heavy drug use, for example, the hardest part is the physical withdrawal. And I know in past videos people have been mad because I compare it to the flu. I'm not saying fentanyl withdrawal or opiate withdrawal is like the flu by any means. It's just a comparison I use, okay? Fentanyl withdrawal is obviously a million times worse than the flu. It's a lot worse, but I just use that as a comparison factor, okay? That's it. The thing that's interesting, though, is when you look at something like Lyrica, and gabapentin has not been shown to be as effective. It's been shown to be more effective post 6 days after the physical withdrawal is subsiding, essentially. It's been shown that when you're having those heavy-duty cravings where you're not sleeping, you have severe restless leg, the stomach cramps, the sweats, the anxiety, the racing thoughts, the dizziness, you name it when it comes to fentanyl withdrawal. You just feel like it's the worst of the worst, okay? The problem sometimes is things like Suboxone, which is prescribed, which is a great drug for opiate withdrawal or even fentanyl. You can't take it right away because you can go into precipitated withdrawals, which you can check out those videos I've made in regards to that as well. What I think is cool about something like Lyrica is they could have taken their last dose of fentanyl or, whatever, their last hit of it, and start Lyrica treatment 300 to 600 milligrams a day, and it has been shown to actually have successful results. There's multiple studies I was reading about over the past couple days that has shown that not only has it shown promise, but there's been actually success from people for 3 to 5 days. Actually, I think it was 3 to 7 days, taking anywhere from 300 to 600 milligrams a day. So typically 300 in the morning and 300 at night of Lyrica for the heavy duty fentanyl too. So this can work from fentanyl to that carfent stuff, the tranquilizer. They take that for about 6 days to get through the physical withdrawal. And then from there, they can transition to things such as gabapentin, or if they wanted to go to Suboxone or methadone, that could be used as well. Because as stated, one of the biggest problems when it comes to Suboxone is potentially going through the precipitated withdrawals. And for some people, Suboxone is not a medication that, unfortunately, it just doesn't work for them. And the other thing about Suboxone is if you're trying to get off of it, it is not easy to get off of it. It gets into your bones if you take it long term, and the withdrawal just seems, it's obviously it will end, but it's a little bit longer than even things such as fentanyl, heroin, you name it. And it's not pleasant at all. But the thing about Lyrica is if you took that long term, yeah, there obviously anything you take long term, you can have a withdrawal from, including things like Lyrica which once again is a nerve pain, activates those GABA receptors. It doesn't directly affect your dopamine receptors. It helps regulate the response for the release of dopamine and serotonin. What I'm really wanting to get at is, after that 5 days of stopping, if you potentially could be through most of the physical withdrawal, it's a good transition from there to maybe if you wanted to taper off of it or go to something like Suboxone or try to cold turkey from there even. There's also another study I was reading. I'll link this one where people were just given that for the first 5 days, 3 to 600 milligrams. Then from there, half of the group didn't take anything, which I think it was composed of 10 people didn't take anything after the Lyrica. 5 of them relapsed. And then so 5 were successful and are still successful. And then the other 10, because it was composed of 20 people, they transitioned to either Suboxone or Methadone, and 8 of the 10 were successful long term. So what that shows me is, at least with Lyrica, that right there would be 15 of the 20 were pretty much, 15 out of 20 were pretty much successful on this. And it's something that unfortunately with fentanyl becoming even stronger and these street drugs becoming even stronger, there needs to be more alternative treatments, which unfortunately there just isn't today. We know obviously of Suboxone, we know of Methadone, we have these, buprenorphine, same thing, Subutex. We have these, but yes, they help people. Yes, they can be used long term, but a lot of people don't like using those long term. And in particular, just getting transitioned over to Suboxone or even Methadone can be really tricky. Not to mention with Methadone, you a lot of times have to go to the clinic every day for at least 2 to 3 months until you can show that you're clean and not pissing dirty. Unfortunately, that's what happens until they can establish a rapport with you, and then you can get a monthly script of it. So that draws a whole nother loop into it with something like Methadone. Suboxone or Subutex, you don't have to go daily. You can get it. I think you'd have an appointment like every 3 months. So you'd get a month's supply and you'd go refill it from there. But I just think that's really cool because I've seen precipitated withdrawal in the psychiatric setting so many times, and that makes it even worse. So picture somebody detoxing from fentanyl. They're given a Suboxone too early. Suboxone with naloxone, with naloxone in it, it essentially shuts off those receptors and throws you right into withdrawal right away. And the withdrawal is even worse than it flips it right away to where you'll be throwing up, hard to sleep. You feel like death, essentially. So if somebody's ever went through precipitated withdrawal, they're going to be scared to even ever try Suboxone from that point on. It's like a trauma response to it. So my whole point is, if there's nothing like a precipitated withdrawal to something like Lyrica that could be used as an off-label treatment, it should be something that should be an option that should be presented to patients who have tried Suboxone, who have relapsed numerous times. They can't make it through the physical withdrawals. I think it's worth trying. My own opinion on that. As an off-label treatment, I mean, you think about it. You think about the problem with everything going on today when it comes to not only Methadone, not only Suboxone, not even heroin, not even fentanyl. Everything has withdrawals within those. So the pharmaceuticals there's a potential for withdrawal. And a lot of these meds aren't designed for you to be on them short term. You have to build up sometimes a little bit in your system for them to be effective. I think this is cool because it can be kind of a quick fix get you through that physical withdrawal, and then potentially you don't even have to, after that, not take anything like a Suboxone or methadone. Or if you do want to take that, that's an option. It presents more options for you because, I've seen continuous times people have come in over and over again, or just even in AA or NA meetings where they come in and it's the same cycle of they relapse, they were taking Suboxone, they were taking methadone, they end up going back to heroin. And it's this cycle of, a lot of times it's, they start Suboxone, they want to get off it, then they end up just going right back. It'd just be interesting to see if they gave this a little bit more attention, where it could actually take this, this serious problem, this opioid and opiate problem, because even though it's prescribed for nerve pain, fibromyalgia, just pain in general, the off-label use should be considered. That is my own opinion on it. I know this is a random video, but I've been reading a lot more into alternative treatments for people who suffer with opiate use disorder, or they've used fentanyl or that Carfent stuff, which is like not even designed for humans at all. It's like what they use for like horse or elephant. It's like a horse or elephant tranquilizer, which is a whole nother ballgame of insanity to come off of. But with addiction, you got to realize that it might sound wild, but for the person using, they're just trying to feel normal. And when you continue to use over and over and over again, you'll be willing to try more crazy things. But with that, we should have more exposure to different treatments for people in order to get them back on the right track to where they can be successful in society again. It's kind of like the idea of, I've talked about even kratom being an alternative potential treatment. I'm not for it. I'm not against it. I've just seen it helps. I've seen it help plenty of people get their life back on track. It should be treated like that, something like Lyrica, especially getting through that physical withdrawal, and if you're worried or if you've been through precipitated withdrawal in the past. Random quick video. I'll be doing more videos soon. I'm sorry I haven't been doing a lot recently. I've been going through a lot recently in my life. So just, keep me in your thoughts. I'm trying to get everything back on track, but I'll try to do a video. I'll try to do one like once a week from now on, but the channel's not going anywhere. I was reading some articles on this and I thought if it could help anyone, hopefully it does. Love you all. Like, subscribe, comment. Peace out. Have a great weekend coming up.